newer dementia. The last speaker in the session is Dr. Anurag Tiwari. He will be speaking on use of blue light in acne. Dr. Anurag, we have come all the way from Bhopal. So share your experience.
It's a pleasure to be here, sir. Thank you very much for getting me here. Dr. talked about the medicinal what's new and happening here. I will be talking about blue light in acne, which is possibly one of the newer things on the block, a new kid on the block, using lasers to tackle active acne. So this concept started with unique advantages, and it has got a multifactorial usage. It's not only for acne. So this is the blue laser concept. We know the blue laser works in the range of 400 to 520 nanometers, and any wide range of application does not harm the skin. So that is what we need to remember. So this is the area which, can I have a pointer? Yeah. Well, blue laser has been there for a very long time. Started in 1960. And if you quickly come down, laser nahi chal raha. So the Nobel Prize was given in 2014. So invented the blue laser. Current challenge, अपने आप चल रहा है ये. एक मिनट बेटा उसको अपने. It has got a low penetration. That is something which we need to remember. It just penetrates up to 0.7 millimeters, so very safe. It does not cause any deep burns or anything to the patient. It is absorbed by melanin and by oxyhemoglobin. The point here to remember is that it is not absorbed by water. When it's not absorbed by water, so thereby the parallel destruction of tissues does not happen, so it becomes relatively safe to use. It has got three mechanisms of actions. It acts as a coagulant, it acts as an ablative laser, and also as a bactericide. So all these three mechanisms of action say about the versatility of the machine, that it can be used at a lot of places. We all know about porphyrins. We know how the photoactivation happens. We know what happens with that. But the point to consider is that the porphyrins are absorbed in the range of 400 nanometers. So this is what the laser targets, and this is how the laser works, and that's the mechanism of action. It's absorbed and it kills the Propionobacterium acnes. Well, this has been used in ophthalmology for a very, very long period of time, but the lasers were weak, so we could not use it in the cutaneous applications. We got this particular laser recently, and I'll show you how we go on using this particular laser, how you can treat the active acne, particularly even nodulocystic acne, and help your patients. So it's got two spot sizes actually. It's got a 1.1 millimeter and it's got a 1 centimeter square size. You first apply it on the infected lesion, meaning you burn a hole on that particular area, give 2 to 5 shots with this particular handpiece, evaporate a small portion of the skin of the acne lesion, bring out the pus inside it, and then comes the beauty. You use the large spot size and apply it all over the area where the acne is located. So thereby you create a disinfection in that particular area, the surface area of the bacteria. It acts as a bactericidal light. So this is how the blue laser is working. It's entering inside, it's going to kill, and then you ablate the surrounding tissue. Thereby, the surrounding tissue also becomes bacteria free. So once again, 1 to 2 shots are given with the fine, powerful laser. Remove the thin layer, extrude out the pus, and if necessary, some pressure can be applied to extract the particular comedone or the nodulocystic lesion. Then we do the vaporization and the coagulation. So through the hole you have created, 2 to 3 shots are made in that particular area. The remaining pus and photocoagulation happens, thereby the walls of the lesion, and you prevent the entry of new pathogens in that particular area. With the large head, you sweep along the lesion. And actually, they have done a study, I'll show it to you, in which 92% patients actually showed improvement in their nodulocystic acne. Comparing it to traditional treatments, you can see that while you're using peelings and soaps, etc., with microdermabrasion, whereas this cleanly unobstructs the blocked pores and then causes the bactericidal effect, as it's more powerful than the LED, conventional LED lights. So it's not an LED light. The blue light is not the light. Blue light is this laser, which we're talking about. Once again, a pictorial about how it is used. This is the clinical study which I was talking about. Although a very small number of patients, they were not on any other medicine apart from the laser, and they were treated in 10 shots were found on each acne lesion, depending on the size and the type of lesion. They compared after a single lesion in 72 hours. The difference between the patients ranged, it started with 18.7%, it went down to 5.9 at 72 hours post-treatment. So there was a major difference in the acne activity in these patients. After day 7, it jumped on to still lower. It went down to 3.08. So it started at a peak, went down, and you can notice here in the graphs. Obviously, when that is the kind of an improvement, if the patient develops, the satisfaction rate also goes up. And with the intervention, the satisfaction rate of patients was up to 92%. So that's a pretty high percentage of for acne. These are a few patients who were treated with active acne, and these are before afters. It's actually, you can see it's the next day. So inflammation has gone down, the lesions have gone down, and looks much, much better after 3 days. So we know there are no equipment or devices which can treat the pustulous lesions. Now, this particular blue light laser, it gives you improvement in 48 to 72 hours. While you use on this kind of a nodulocystic acne. So it takes 15-20 minutes. It's a diode laser, so it does not have any consumables in it. So it works for a lot of treatment modalities, and it's the latest technology, accurate, no anesthesia required. It's portable. That's the beauty of it. If you have multiple clinics, you can carry it. Low maintenance, well, does not go out of fashion. And if you compare it with LEDs, they are slower treatments and low power. They're not portable. Benign lesions can be treated with it. Seborrheic keratosis, solar lentigo, vascular spironevi, telangiectasias, acrocodons, seborrheic keratosis, seborrheic hyperplasia, melanocytic nevi. It's a whole lot of list which can be treated by this particular laser. So you can combine the treatments. You can use the coagulation mode for the vasculature, or you can use the cutting mode for ablating the simple things like an acrocodon. So it's a simple, riskless, visible effect, seeing immediately, many candidates, no anesthesia required. And this is a comparison of the active lesions with other technologies which are available. So you can see a lot of benefits of this particular blue laser. That's no bleeding, accurate, local anesthesia is not needed. These are the technical details. And as they say, good things come in small packages. This is one of those small little lasers which can help you in treating your nodulocystic patients' acne. So the future is here. I thank you very much for a patient listening.
Yeah, clear. Any.
They have sold a couple of machines here. I'll ask the company people to give you a ballpark figure. But is anybody from the company here? What is the cost of it, Ambika? 15 lakhs plus GST is the putting price. So I think that's, sorry, sir.